Hi, welcome to this session where we're going to talk about pink and steel Pilates. I have with me two of my wonderful franchisees, Megan Clark and Andy Schmidt. They're Active Physio, Albany. So Megan, I hear congratulations are in order. You are Pink Pilates Therapist of the Year. So tell me, what is Pink Pilates all about?
Pink Pilates was designed by a physiotherapist. She was seeing a lot of women come through her clinic that had problems with their shoulder following breast cancer surgery, and she just thought that there wasn't a lot of rehab out there. So she developed this program a few years ago now, and what the Pink Pilates program is, it's a specific individualised exercise program to help women going through cancer regain their physical fitness, strength, body confidence, and also to help incorporate exercise into their lifestyle. The Pink Pilates program is available to any women going through cancer. Originally it was designed for breast cancer only, but due to the success of the program, it's now open to all women dealing with the cancer diagnosis.
Wow, that's great.
Yeah.
And so, Andy, out of this Pink Pilates came Steel Pilates. So tell us about that.
Sure. Well, the founder of the program, Lou James, was asked by many health professionals in the cancer field, once the Pink Pilates program was successful, to develop a program that would then be able to be accommodated for men. So basically over the last year she's now developed Steel Pilates as well, in conjunction with a lot of health providers as well. The philosophies and ideas behind Steel Pilates are similar to Pink in that we're trying to basically help men back into exercise, fitness and health following their cancer diagnosis. Again, it's a series of individualised one-on-one programs, and what we're trying to do is incorporate obviously health, lifestyle, strengthening and exercise back into these men's lives after their cancer diagnosis. So a really helpful and effective program for a lot of people.
Absolutely. And are there differences between the two programs?
While the ideas and philosophies between the two programs are the same, there are some differences in Steel Pilates in that often there's different surgeries and treatments that are needed for the men's cancer treatment. For example, if there's been abdominal or prostate cancer, it may be that abdominal or prostate surgery is involved. So that will mean for the men, it may be working on, say, the pelvic floor or abdominal strengthening afterwards. But basically, both the ideas are the same, in that we're trying to obviously get people back into health, fitness and exercise post-cancer diagnosis.
So Megan, when should a woman, say post-cancer, say breast cancer, start at the Pink Pilates program?
Well, you can start the program at any stage of your recovery. It is broken into 3 phases, which each have different goals that we try to achieve. So if we start off with the post-op phase, so that's kind of in those early weeks after you have your surgery. The focus then for the program is to regain your range of movement, help with the healing process, start you on gentle exercise program. And in that post-op phase we may use exercise, but also manual therapy, breathing techniques, soft tissue massage, so the whole realm of physiotherapy treatments as well as the Pilates side of it. Then you've got the recovery phase. So the recovery phase is when you're going through your cancer treatments, whether that be chemo or radiotherapy. And the real focus in that phase is to battle fatigue. Okay, so fatigue is one of the most common side effects from any cancer treatment. And exercise has really been shown to help battle that fatigue. So the focus in that recovery phase is to get them exercising, coming along to an appointment that it's about themselves, not about the cancer. I think that's a really important thing. And then we move into the fitness phase. So some ladies like to start once all their treatment is completed. You know, they've got a lot going on in their lives. And finally they think, okay, now it's time to kind of get back to where I was. So that fitness phase, we tend to work a little bit harder into the exercises. Again, it's really individual. So if a woman comes in and has never exercised before, then we take her from the very beginning. If she used to be a really fit lady exercising a lot, then we can work a lot harder with her. And the focus in that fitness phase is just to get them back to their pre-existing health.
Great. And you've mentioned fatigue, and what are the other benefits that a woman could expect, and what sort of time frames would she expect to see these sorts of things happening?
The overwhelming benefits is a return to strength and fitness, really. So they are the most important physical benefits that women get out of the program. But again, in those early days, it can be just something as simple as being able to lift your arm to wash your hair, you know, so just really simple goals. But the The other side of the coin is there's lots of psychological and emotional benefits of the program, and I think that's what women find surprising. They come along to these sessions feeling that, you know, this is an exercise session, but they walk away with this sense of control. It's like, wow, I could do something that I couldn't do before. I didn't realise that I could do that. So the benefits are both physical and a lot of emotional benefits through there as well.
I can see you must love that work.
I do, I love it.
And you, Andy, what about these guys at post-surgery for cancer? When are you getting them in to get started?
Sure. Well, similar with the Pink Pilates program, there are 3 distinct phases in terms of being the post-op phase, the recovery phase and the fitness phase. So again, obviously it depends on each individual circumstances. The really important thing to remember with the Steel and the Pink program is that they are individualised one-on-one programs. Obviously everyone's circumstances are going to differ in terms of the type of treatment they've had, the type of cancer they've had, where they've come from in the past and in terms of levels of fitness and what have you. So it's basically tailored to suit each individual. For the men, obviously, we're also trying to target similar things in terms of strength, flexibility, cardiovascular fitness. A lot of the time for the men, a lot of the cancer surgery will involve, as I mentioned before, abdominal or prostate surgery. So again, it tends to mean that a lot of pelvic floor and core stability type strengthening and Pilates work is needed for the men as well. One of the really important things for the men is that as males, we tend to often have a bit of a facade of kind of control and understanding of medical problems, and in reality that's not often the case. So what we find is for these men to be able to sit down and actually open up to somebody about the type of problems they've been having, it's actually quite a cathartic experience for them, that they can start to identify the problems, put plans in place to deal with them, and then start the process. So to be able to sit down with someone like myself, you know, it's quite an achievement for these men to be able to open up, talk about where they're going, and obviously get back on the path to their recovery.
Sounds great. And what about this word Pilates? I mean, do you think it puts off blokes coming?
Yes, we do get a few questions about that. I tend to answer that by saying, well, at the end of the day, Pilates was invented by a male, so I guess you can't get much more manly exercise than that. The reality is too that, I mean, for example, all top professional sports teams, from the All Blacks to the Black Caps to Man United, all do some form of Pilates or core strengthening. So again, that's a pretty manly thing to do as well. The other thing to remember too is that the name of the program is Steel Pilates, but the Pilates and core strengthening side of it really is only one aspect of the problem. As Megan's touched on, some of the treatments are going to also be strengthening, some weights work, circuit work, strengthening, and again, these are all quite male things to do as well. We know that males like having weights and repetitions and circuits involved in their exercise programs, so a lot of these are actually incorporated into the Steel Pilates programs as well.
Great. Now, I understand that the Pink Pilates Trust has some way of subsidising some programs, but I'd like you to talk a little bit about that, and maybe also, if that wasn't the case, how an individual would fund the program.
Sure. Often people will have health insurance in place, and so depending on the policy, there's often a provision for them to be able to have some physiotherapy, particularly post-surgery. So obviously in that case, you know, it depends on the policy, but often private insurance will cover that. The other thing that we welcome is that it's quite helpful for perhaps groups of friends or family to perhaps all pitch in to purchase a package of care for the clients as well. We know that a lot of friends and families are often quite willing to be able to do something to help, but they're not really sure what. And this is a great opportunity for them to be able to pitch in and actually do something for the client that's going to give really value and meaning back to the person's life.
It'd be a very positive thing to do for somebody, wouldn't it?
Regarding the trust, for both Pink and Steel Pilates, there is some funding available really for those with the most need. I guess unfortunately, like any healthcare program, it's not government funded, and so the trust is very much reliant on fundraising and donations to help those people. So really we try and keep the funding for those really with the greatest need. One thing that Pink and Steel do actually encourage a lot is for their physiotherapy providers to be quite forward in initiatives to actually do fundraising for the local community. So I guess another way that people can help is if they know their local Active Physio is doing a fundraising initiative for Pink or Steel Pilates, get in behind and donate or come along to the event, and that'll be really helpful as well.
Great. Well, thank you so much for talking us through those programs. There are so many benefits that are obvious, and we just need to get the message out there so people being challenged with the need to fight cancer can be helped with this sort of program. And you are free to look on the website and you'll see the steel and pink Pilates therapists under Active Physio in our branches. So thanks again for coming.
You're welcome.
Thank you.